It's Thursday, October 15th. Welcome to the Kahnawà Task Force update for the 15th of October, halfway through the month already. And we have a busy program today. We will talk Halloween. We will have a visit from Lisa Westaway and Lloyd Phillips. But starting things off is a task force member, Arnold Lazare.
Good afternoon, Kahnawake. As we mentioned earlier, the task force is always challenged with making things in a balance. And Halloween is no different. We announced a few weeks ago that there was no intention to cancel Halloween, but we needed to make sure that it was done in a safe way, as all of our actions are nowadays. Once we mentioned that we would be not canceling it, because never is the intention, we did receive a whole bunch of suggestions. And what we have today is pretty much the consensus of what can be done and what can't be done. We would like to thank all the people who contributed. The task force does listen to suggestions, and anybody that has ideas are welcome to put it forward. And I think that today we'll see that a lot of the suggestions have been accepted, and it'll allow us to move on. So first and foremost, that came priority-wise was the Halloween is on a Saturday, which is a good thing. We're anticipating hopefully good weather, so we're not going to change the date like we had to last year or what other jurisdictions had to. But the big part is going to be a communication plan informing everybody that our Halloween event is for locals only. There's in an effort to continue limiting the number of people that gather. It's only going to be Kahnawake Ronu, and we are going to be putting out messages to say that in past years there's been a lot of people not from the community. Well, this year we're telling them they're not invited because we want to keep people safe. So that is going to be a big part of the messaging, that it's going to be for only residents. Once again, we talk about the ABCs of trick-or-treating. First, A is airway. We want you to protect yourselves and others by wearing the proper face mask. Once again, this includes maintaining social distancing, maintaining good hand hygiene, and by wearing a mask. In terms of B, it's the bubble. We want you to stay within your household bubble. That is what's going to work. We do know that all of the previous issues have been from gatherings. And the lower we keep the gatherings, the better chance we have. And once again, C is contacts. Don't mix the bubbles. Although we know people will want to get together, now is not the time to do that. So an important part is we need to acknowledge that not everyone is comfortable with having people come to his or her home. So we're asking people to respect everyone's decision, whether or not they want to participate in Halloween. That was one item that came very clear. Once again, as in all issues, there was two sides. People saying, I'm going to take my kids out come hell or high water, and other people were saying, I really don't feel comfortable, so I won't participate. And we trust that people will respect individual decisions. An item that was very clear is that we're recommending or having the trick-or-treating occur between 3 p.m. and 7 p.m. Given it is a Saturday and it will still be light out, it's safer for young children. That's who we're aiming the trick-or-treating at, is the young children. We don't want to take that event away. And also, it will be easier for families to monitor and minimize the opportunity of being together. So once again, 3 to 7. Now, these ideas are pretty much consensus. They ranged from as early as 1 to 4, 3 to 7, and 7 to 11. The most of the people admitted that 3 to 7 was a common sense decision, and we trust that people will respect it. Now, in terms of safety first, we're asking people, telling people, we're trying to educate people, whatever way people want to take it, is don't go out if anyone in your household is experiencing COVID-19 symptoms. Once again, we're going to be redundant with some of these items, but we want you to say, if you're experiencing symptoms, please stay at home. And once again, ensuring the 2-meter distance, from anybody that's not in your household. And we're maintaining the household items. We're saying only go to family and friends that you know and are expecting. And once again, that goes back to the issue of people maybe not wanting to participate. So here's some ideas that we've received, and it's only limited to people's imagination. Well, this is not a suggestion, but more a compulsory. Wear a mask when answering the door. We know that masks are effective. Wash your hands prior to preparing the goodie bags. Nobody wants to contribute to the spread. Use a hand sanitizer at the door and sanitize in between guests. One item is to use a lacrosse stick when you're distributing the candy. There's a lot of lacrosse sticks in town, and it's culturally appropriate. Use a grabber tool or a claw to treat out candy bags. Use a fishing rod with a clothespin. So they say a clothespin, so it can easily be taken off. Use a slide of some sort to send candy down a porch. Using a PVC pipe, once again, using an imagination. Use individually wrapped candy bags that can be gently tossed to the children. We don't want anybody whipping them at it. You could use your pool skimmer. Use a tray and space out candy on the tray and leave it on the table by the driveway, and you'd have to replenish it as needed. Once again, we don't suggest putting a whole year's supply of candy on there, because after 1 or 2 kids it may quickly disappear. So another suggestion that came in was buy large chocolate bars to give out, as they are easy to keep and easy to be separated from one another. Now, one of the thinking outside the box items that came in was have an alternative in doing a family ride-by. And instead of having the children's trick-or-treat, have the people go to the children, sort of like what the many drive-by or ride-by parties there's been in the past few weeks. They've been relatively successful, and once again, it'll get the required candy to the kids that everybody's looking forward to. Some of the items that we're saying are mandatory, and it would be only 1 household per vehicle. Okay, we're stressing that household because we know that's where our issues have come from. Stay within your household unit. There is going to be a big desire to merge. Well, we're saying please don't do that, because once again, we know where the problems are. Only 1 household at a house at the time. So we're being consistent. We don't want anybody picking treats out of a large bowl. The chances of contagion increase. Don't enter any house. So we're trying to keep that distance. Now, Kahnawake has a history of trying to scare the treaters, and some use mechanical, some use very novel ideas, but we know that screaming and yelling is a risk of spreading the virus, so we're asking people not to do that. And of course, everybody needs to wear a proper mask. Now, here are some general suggestions that we've received. Ensure that the child or children don't eat or rummage to the bags until they get home, and you can re-sanitize them as a precaution. Bring hand sanitizer with you when necessary, and all trick-or-treaters need to wear a proper face mask. It'll be nice to have a cute Halloween mask, but we really need one that would protect them. Only eat or distribute candies or treats that are individually wrapped. Once again, it comes down to safety. And when you get back home, remove the costume and shower or bath before roaming around the house. So we are confident that by people following this, we can have a happy Halloween. The children won't be denied, and some of the stress of this crazy time will be reduced. This is an attempt to get us out of the current wave. And we need to remind people that by taking appropriate action now, we will prevent a further escalade. And Christmas is coming down. This is a good opportunity for us to prove, Kahnawake, that we can do things in a safe way. We want people to do things in a safe way, and we look forward to people having a happy Halloween. There are several other publications that will go out, so we trust that people will adhere. And once again, we're explaining it with the hope that people understand the education of it. So if you understand why we're asking these things or telling these things, then people are more likely to say, okay. And it is based on recommendations from many people. And again, we'd like to thank all the people that submitted suggestions, and we look forward to a safe Halloween. Nyawa.
All right, thanks, Arnold. And we've been doing this now for going on 7 months or thereabouts. And the Halloween questions far outnumber all of the other questions. Not since the pool situation, the opening of the pools back in about April, have we seen this much, communication, shall we say. All right, coming up next is the Executive Director of the Kahnawà Memorial Hospital Center, Lisa Westaway.
Good afternoon. So I just have a few updates today to provide to you. The first is actually another subject that we've been receiving a lot of questions about, and that's vaccinations. Although it's not specific to COVID-19, we wanted to talk about it here because it is related, and we know that there is going to be a big demand for vaccines this year. And of course, we would urge you to have your vaccine done. So we still have not received vaccines. We will only be receiving them the week of October 27th. And the vaccination program will start the week of November 2nd. So it's always that first week in November. I think that's the same every year. We are not getting them early this year because of COVID. So really the first week of November. Dawn is going to be here next week to give a lot more details about how this will all roll out. But I just wanted to give you a few preliminary details. So one thing that is going to change this year, actually there are two things changing this year. The first is that we're going to try as much as possible to organize the vaccine campaign by appointment. So we will have a system in place where you can go online and book an appointment, or where a family member can book an appointment for their loved ones. And you'll get more information about this next week. Another big change, because we can't gather, is that we will not be offering the vaccine at the Golden Age Club. And so many of our vulnerable community members, our home care patients, will receive the vaccine at home. So a nurse will come to you to provide the vaccine. And we also will be using renting the Legion downstairs. And again, vaccines will be by appointment. So it'll be very organized, and a very organized vaccination year, so we won't have long lineups or groups of people. So again, you'll be getting more information about that next week. Secondly, I'd like to talk a little bit about the community health check, something we've already mentioned, but just to confirm that we did start the community health check today. So you will be receiving phone calls. We'll again be making our way through calls to everyone in the community to request or ask questions about how you are feeling, or members of your household as well, and make recommendations for testing if the need is there. So please answer your phone. So speaking of community health check, I want to talk a little bit about the testing site because we, again, as I mentioned yesterday, we have low numbers. So we're testing about 10 people per day. We do have another positive case today. So we're at 13 positive cases in the second wave. We have 5 active in the community right now, and we do have a couple of cases where we're unable to identify the origin. So where did the first case come from? We are unable to trace it back. So this is important. What this means for the community is that you always have to assume that the person that you're with or near or crossing paths with potentially has COVID-19, and therefore the importance of always following distance, hygiene, and masks. And if you're following those elements, then you are protecting yourself and you're protecting those around you. But I still want to highlight the fact that despite the fact that we have another case, despite the fact that we do have a few cases in this second wave, that the community is following distance, hygiene, and masks. And we can say that with certainty because of the low amount of contacts every time that we identify a positive case. So again, congratulations on that, and we need to really continue because we will continue to see positive cases as we move forward. And again, that's the goal, is to limit the amount of contacts. We spoke a little bit this morning on the radio about what's happening in the hospitals around us, so I just wanted to reiterate that information because we sometimes have different viewers on the radio compared to Facebook Live, so I just want to make sure I'm giving the same information. And I think it's important to know what's happening in the hospitals around us. So right now they're really experiencing a shortage of staff for several different reasons. Some are off for COVID-related issues, others just from exhaustion. And it means that there are many services now that are being stopped, or surgeries that are being stopped, so that they can move HR or human resources to different parts of the hospital. We do see that the ERs are overcrowded. I'm not giving you this information to stop you from going to the emergency room if you need to. You will receive the care you need if you go to the ER. However, if you don't need to go to the ER, I would really urge you to contact the KMHC to have your situation assessed over the phone. So this, of course, is not for an emergency-related issue. You don't call KMHC if you need to go to the ER, but for mild situations, if you normally would go to the ER for an ear infection, for example, that might not be what you would want to do in this case. So please contact KMHC and leave a message for a physician or to speak with the nurse so that your situation can be assessed. One last thing is the drop-off. So the drop-off for inpatient will be this Sunday from 10 to 1. And again, we're asking you to bring in winter clothes, cigarettes, or hygiene products. No food for this drop-off. And we'll be communicating with you at a later date for any subsequent drop-offs and changes that might occur in that regard. So thank you very much, and be safe. Sorry.
No need to apologize. Lots of information so far this afternoon, and Lloyd Phillips, of course, our keynote speaker today, will finish things off. Lloyd?
Thank you, Joe. Thank you, Lisa, Arnold, for that information regarding Halloween. Like Arnold mentioned, I just want to reiterate the fact that obviously the goal is to have something that can be done in the community, you know, mainly for our youth, to have activities to feel more sense of normalcy. But again, keep in mind that we are still in the midst of a pandemic, and we definitely want to make sure that we do things in the safest possible manner. Also, I know the KYC, Kahnawà Youth Center, is also in the process of developing some activities for the youth, as well as KSCS is going to be doing various activities, organizing scavenger hunt for a community, family-oriented activity, as well as other activities such as a pumpkin carving contests and things of that nature. Again, just to encourage families to stay together within their bubble, so to speak, and but still able to participate in the activities that we all enjoyed over the years. Just a couple of points I want to talk about, because as we mentioned many times, we always want to keep track of what's happening on the outside of our community. And Lisa did mention it a little bit, some of the hospital situation. But as you may have watched some of the local media, they talked about the numbers stabilizing in the province of Quebec, which is true. But keep in mind that there are still, on average, a 7-day rolling average of 1,000 new cases within Quebec, which is still very high, and we have to keep our mind on that. Even though things, generally seem to be stabilizing outside in the community, again, it's no time for us to relax our own personal compliance with hygiene, masking, and distancing, as well as other measures that are in place. I mean, they're all here for the betterment of our community. And I mentioned in the radio this morning, and I'll repeat it again, because some of the current measures that are in place regarding the household only and no visitation unless for certain circumstances, the measure that was put into place last week, we didn't want to put an official timeline on that like Quebec had done. But we did want to say to the community, once again, as soon as we feel confident that we could either modify or reverse that directive, we will. We understand the impacts it has on the community as a whole. And the health check, which Catherine Memorial Hospital Center is currently in the process of doing, helps give us a better snapshot overall what is happening in the community. Because last week, when we announced the new directives, that was one of the primary reasons why we had to take action, is because of, one, there was a backlog in testing, which unfortunately we're getting many of the results now, but overall we didn't have a good sense of what's happening in the community. And once all these elements come into play, health check is done. Again, a constant reassessment will be done, and things will be adjusted accordingly. If the medical evidence is there, and we'll take it day by day. So again, I just want to reassure the community that we're watching everything very closely. We're trying to be as proactive as we can to address the concerns of the community. We understand the stressful time that everybody's living. We understand various measures that are put into place are not easy to comply with, and it causes stress and anxiety on everybody. But as long as we stick together as a community, which we've been doing very well for the past 7 months, and the weeks to come, we will continue to be safe as we possibly could be, and again, assess as days go by. So with that, I'll leave it now for Joe to close up, and I'll see you again soon. Anigawahi.
Thank you very much, Lloyd. All right, so just a couple of notes here before we leave. Lloyd mentioned the testing site and the former backlog. Well, that has all been cleared up now, so the wait is now 24 to 48 hours. For a while there, it was sometimes 7 or even 8 days, so that's been pretty much straightened out. And earlier, of course, Arnold mentioned Halloween, and for anyone who is viewing this today who is not from Kahnawà, in the past few years, I know at my house we would get about 10 or 15% of the visitors, the trick-or-treaters, coming from out of Kahnawà, which is, I guess, a real nice reflection on the hospitality of our community. But this year, we cannot do that. So just to make sure that we get that message out there. And finally, a note, COVID-19 hits all over the place. If you're a football fan, you might remember the name Fred Dean, who was a Hall of Fame, two-time Super Bowl champ for the San Francisco 49ers. He died at 68 of COVID-19. So it does hit everywhere. We have to stay cognizant of that and do all of the measures that we've been saying over and over and over. So with that, we'd like to thank you for watching today, and we shall see you next time. It's a beautiful day, still is, so if you can, get out there and enjoy it, and we'll see you next time. On behalf of everybody, Niao Koa Dano, Onigiwahi.